Hafa day, everybody, and welcome back to the show. I'm still Jason Salas, and you are watching KUM News Extra on YouTube, on Facebook Live, and on KUM at TVA. Thanks so much for joining me once again, because I am joined on the KUM couch this evening by three learned medical experts in the field of spine surgery and bariatric surgery. We will find out what that means in just a moment, but they are three gentlemen, three physicians who are from the China Medical University Hospital in Taiwan. On the left side, we have Dr. Huang from the BMI Center.
Hi, how are you?
Hafa day, doctor. Very nice.
Yes.
Very nice to have you on Guam. In the middle, we have Dr. Chen, also from the Spine Center.
Hafa day.
Yeah.
I'm Dr. Chen from Taiwan China Medical University Hospital Spine Center.
All right, we're very happy to have you here. And also from the Spine Center, Dr. Chang. So doctors.
Hello, I'm Dr. Zhang from Taiwan. Nice to meet you.
All right, thank you for joining me, and thank you for the expertise and the knowledge and wisdom that you are passing down to our medical community right here. So, the purpose of your trip, of course, is to impart knowledge on local surgeons and local physicians. We'll start with you, Dr. Wang. What will you be discussing with our local physicians?
In fact, in Taiwan, China Medical University Hospital, we provide very unique and very pioneer medical service for Taiwanese, but also we would like to provide this kind of international medical service for Guam people. So that's the main reason this time we come to Guam to let most of the Guam people to understand what we can offer them. And three of us, we are surgeons. So I'm in charge of the weight loss surgery, and Dr. Chen and Dr. Zhang, both of them are spine surgeons. So that's the reason that I think we can have some discussion about how the patient goes to Taiwan and how we provide a good service for them.
Okay, well, Dr. Chen, what makes a potential patient a candidate for one of your spinal procedures? Is it people who have spine defects from birth, or is it people who have been through extreme amounts of trauma, say like an auto accident? Or
yes, in our center, we can provide 6 departments, including deformity, scoliosis, and the revision surgery department, and the spinal tumor department, and the minimal invasive and the percutaneous endoscopic surgery, and the cell therapy, and the high-level cervical spine and the complicated cervical spine disease. In Guam, there are many people, their body weight is over. So usually the patient is high body weight, may suffer many degenerative disease on the low back, including the knee or hip disease. So this patient, when they suffer the persistent back pain and leg pain and fail to non-operative treatment, maybe they can seek for the surgical treatment.
Okay, now Dr. Chang, I know osteoarthritis is a condition that would make you candidate for that kind of thing. So
Yes.
Does that only typically affect the elderly, or can it also affect like very young people?
Yes, sometimes there's traumatic osteoarthritis because trauma, they made their joint destruction. Then we also can cure this kind of patient. And also sometimes about hip joint, if there's a vascular necrosis, which comes from idiopathic steroid injection or steroid usage, or sometimes alcohol withdrawal or alcohol using, so they have a vascular necrosis of hip. We also deal with this kind of patients, which we can make them walk again and pain-free. Yes.
Do you also deal with a lot of, and any of you doctors, any of you gentlemen can jump in here, but part of what makes Guamanians very special is we love athletics and we love our sports here. So everybody plays sports. We play year-round because of the wonderful Pacific climate that we're so blessed with. But I'm sure you see a lot of sports-related injuries, specific to the back in particular.
In young adult, they love the sports in Guam, and then the people in this young group may suffer the disc herniation in the cervical spine or lumbar spine, and usually the patient fail to non-operative treatment. We can provide the percutaneous endoscopic surgery through 8mm open wound. So the patient just only can stay the hospital tonight, and they can be back to their ordinary work.
Dr. Wang, is that considered minimally invasive? If it's only an 8mm, is it even considered an incision at that point?
Yes.
Okay.
In fact, right now, most surgery was done by minimally invasive approach.
Okay.
So, in fact, the recovery is very quick. Even we do bariatric surgery, the spine surgery, and the other like hepatoplasty surgery, right now almost 80% was minimally invasive already. So the recovery very quick. The patient returned to normal life in 1 week.
I know there's I forget the name, but there's a medical facility in Minnesota in the United States mainland, but we get a lot of the U.S. commercials here, and they heavily advertise the fact that they can treat a variety of spine conditions, and they say, minimally invasive surgery, it's almost like an outpatient procedure. And they said you can be walking with, if you have severe spinal trauma or, like you said, scoliosis and everything like that, they say they almost guarantee you can be up and walking within 2 days.
Yes.
So certainly these are colleagues of yours in the field, but you're also doing world-class work.
Yes,
truly
because,
innovative.
we are doing the minimal invasive spine surgery, and which we call, Dr. Chen had called is endoscopic surgery, percutaneous endoscopic surgery. It's from a 8 millimeter wound, and this kind of patient can walk the day on the surgery day.
That's incredible.
Yes, so it helps patients a lot to get them recovery from the disease and pain-free quickly.
Okay, now doctor, there's going to be a lot of local colleagues of yours here who are going to be greatly enriched with the information you'll pass down. Have you already talked to some local physicians and local surgeons about your techniques and your pioneering work?
Yeah, in our center, the pioneer surgery of spine, we combine the navigation to the spine surgery in every field, include the spine tumor surgery or scoliosis or kyphosis correction surgery. Even the endoscopic surgery, we combine the navigation. As you know, like Google Map, the car move on the lane. You can know where is the car on the exactly where they are. So we before we surgery, we can get a patient's body structure, and then wear a surgical instrument. They has a sensitive to connect to the imaging. So we can know where are we, the surgical instrument in the patient, which site. So we can very, very accurate to localize the lesion and assist the lesion and correct the deformity or any other spinal disease. Very accurate.
Okay, now Dr. Huang, you and your colleagues are only going to be here for a couple of days. You've got a very, very busy agenda.
Yes.
But what did you know before coming to Guam about the number of patients and the number of cases that would apply to you that we have here on Guam?
In fact, I have treated about 10 cases from Guam.
Okay.
And they can be very, very overweight. The BMI can go to 90. So when they come to Taiwan, we take about 1 week for them to have surgery and come back. So about Guam, as we know that this is very Western style food here. And the obesity rate and overweight is very high, including diabetes, hypertension, those with severe metabolic syndromes are quite more. So in fact, today, we really come over here because spine center surgeons and including weight loss center surgeons, we are treating this kind of very overweight patients. So because overweight always causes some problem of joints, spines, and also metabolic syndromes. So after these procedures, the patient can benefit from this, can lose weight, and also can remit all the disease. So I think our survey will definitely provide the best solution for the Guam people.
All right. Well, thank you very much, gentlemen. We are unfortunately out of time, but we're going to let you go back to doing the very good work that you are doing. And we thank you on behalf of the medical community and patients around here. We really appreciate your visit here. And please have a good stay on Guam.
Okay.
Thank you.
Thank you so
Thank you very
much.
much, doctors.
Thank you.
Thank you very
All right.
much.
And please stay tuned because we will be back right after this.